Greetings, and welcome to Dougy Dialogues. I'm Dr. Monique Mitchell, and we're webcasting from the Dougy Center in Portland, Oregon. The Dougy Center was the first childhood bereavement center in the United States, and we're recognized as an international leader in the field for children and families who are grieving. In these 30-minute discussions, Dougy Center staff will explore language, trends, theories, research, and other relevant topics related to death, dying, loss, and grief. Our intention is to continue to shape the professional dialogue, and we hope to spark some thought-provoking conversation along the way. Dougy Dialogues are primarily intended for a professional audience, so individuals who are working with others who are grieving. If you're more interested in lived experience or perhaps support for your own grief, we encourage you to listen to our podcast, Grief Out Loud. It's available on iTunes or one of your other favorite listening platforms. So welcome, and thank you for joining us at Dougy Dialogues. Hi, Donna. Thanks for joining me today for Dougy Dialogues.
Happy to do so.
Good. So I was thinking for our conversation today, we could reflect on some of the things that are coming up for us at the Dougy Center in regard to the current pandemic. And specifically, I mean, there's a lot of things that are coming up for us, but one of the things specifically is the situation that many children and families are experiencing that's unlike usual times for most people, which is they're not able to necessarily get to a hospital or to a facility to where someone they care about may be dying, and they don't have access to them. And I'm thinking about the recent tip sheet that we published on supporting children and teens when a family member is dying in a hospital or a care facility. And this tip sheet was inspired by a child life specialist in Eastern Washington who was tasked with supporting a heartbroken family who wasn't able to go to the hospital to see or spend time with the person that was dying from COVID. And in our conversation today, hopefully is not just around COVID, but just someone could be dying from cancer or dying from a car accident or whatever they're in the hospital for, and their people can't get to them. Mm-hmm. And one of the things that I was hoping we could talk about in our 30-minute conversation is, you know, we were quite intentional in our tip sheet not to use the word goodbye. And I thought we could maybe spend some time talking about what that means and why we made that decision.
Mm-hmm. Well, I can start out.
That'd be great.
Okay. One of the things that we hear a lot in our society, but also like in the field, is the concept of saying goodbye and like, oh, I didn't get to say goodbye. And so where we are now, that could easily be sort of an umbrella phrase that is placed on people thinking because my person is in the hospital or hospice or not at home and dying or has died, I didn't get to say goodbye. And I really believe it's the wrong phrase for a number of reasons. And one of them is that when youth, and I'll speak specifically about children and teens, when they have been asked in studies, published studies, what would you say to your deceased parent, brother, sister, if you could speak to them one more time? Very, very few of them, a minuscule number, say, well, I would say goodbye. So I think when we say the term, I didn't get to say goodbye, or we need to say goodbye, what we're really saying is, I need to have some sort of communication, if possible, with that person in order to punctuate the reality that they are leaving this world. And I'll just refer to one study that I think is very telling. And there are numerous others after this, but this study was published in 1992, and it's a study that was published in Qualitative Health Research journal called Adolescent Sibling Bereavement and Ongoing Attachment, by a study by Nancy Hogan and Lydia DeSantis. And here's what I found really interesting in it. They asked the question, among other things, if you could ask or tell your deceased sibling something, what would it be? And they took all that information from 157 respondents, teenagers, who said, and they divided their responses into 6 separate categories. Obviously, I don't have time to talk about the whole study, but I'll just point out these couple of things. 81% of them said, I love you and I miss you. That's what they would say, 81% of them. Now, more than 81% said either I miss you or I love you, but 81% said both of those. And there were no prompts. There were no, purely a open-ended question. So it wasn't a check the blank or anything like that. The next highest response was expressing regret. I wish we'd had a better relationship, or I wish we could still hang out together. It's things either that happened or that can't happen. And that was only 37%. The other ones were anticipating reunion, 28%, wanting to know the circumstances surrounding the death, about 20%, and catching up, kind of like, how is it where you are, 19%. And then 9% wanted guidance, like, can you help me out? I have a problem. So when we look at that information, that's just, again, one study of many that have been done since 1992. What people really want to say at end of life and to hear is, I love you and I miss you, or I love you and I will miss you. It isn't goodbye. So I think goodbye represents that kind of need to have some sort of ritual, which is what we're missing now. We can still do rituals, but we can't do them in the same way physically and have the social support that we have depended upon after someone in our life has died. Right. So that's why, that's a long answer maybe to why we didn't use that kind of standard terminology of saying goodbye.
Yeah, and so your response brings up a few things for me. One is, the fact that we're trying to keep this to 30 minutes. So I think, the piece around how do folks, what we talked about in our tip sheet about what are some things that families can do might be another dialogue that we can have. I think you just raised that piece, which is part of what our tip sheet is about. But sticking back to this goodbye piece, it's really interesting because there's a couple of things that you said that bring my own experiences to why we don't necessarily use the word goodbye in our tip sheets. And the first is to say that there's nothing wrong, at least in my opinion, there's nothing wrong with using the word goodbye if that's really what an individual believes they are doing. But more often than not, in my years of teaching at the university before this position, when I was working with students who were in social work and they were getting ready to go out and work with others, they're helping professionals, and the common response was, well, my belief system, I'm not actually saying goodbye to the person. This is not the end for me. And so I think it's important to be very, very mindful of your audience. And when we write our tip sheets, we really try to be as inclusive as possible so that anybody who's reading it can resonate with it. And, you talked about, the question I think was posed, like if you could speak to your person one last time. And again, thinking about different cultural beliefs and spiritual beliefs around that might not be how they perceive it. It may not be the last time. And it's interesting, again, when I think about the findings, where if I heard you correctly, one of the things that a child would have said is, can you help me with this problem? And if they're posing a question to a person after they have died, then really what they're feeling is some sense of continuing bonds or some sense of still having connection with the person. So that punctuation you're talking about and that ritual makes sense for, I'm thinking about folks who believe in life after death, for example. They don't, and some people believe that when you die, that is it. And saying goodbye might be very much aligned with that belief system. And then others where they believe in life after death might say, I need this punctuation. I want to know what I can say to this person while they are in a physical body, living. But I believe, if this is someone's belief system, that afterwards, after a physical death, that does not mean the relationship dies.
Mm-hmm.
And I just want to move us to another word.
Well, can I just say one more thing about that, Monique? Because I think in what I would say there too is that we have to be careful when we use terminology, that we're not just using terminology like of the dominant culture or what we perceive to be the dominant culture, that there are cultural differences. And I'll just say my mother, for example, who's 91, has talked numerous times about how she wants things handled at her end of life and what she wants. And she'll say, and I don't want you to say I died. I want you to say I passed on, because I believe that I'm passing on to heaven. So it's important, like, to use the terminology that people use for themselves.
Absolutely, Donna. And I think that's one of the things that we, teach at the Dougy Center when we're training facilitators or folks at Summer Institute, is really about that reflection piece, about using the words of the individuals and aligning with the beliefs of others when you're supporting them, providing support. And so just kind of a little bit of a shift, which reminds me of the goodbye piece, is the myth of closure. And I think about Pauline Boss's work, who I adore Pauline, and a lot of my work has, been inspired by her, her theory of ambiguous loss. But she says that closure is a terrible word to use in human relationships because, there's always going to be the physical, the presence and absence. And both of those things exist in relationship. And really what we need to do is tolerate that ambiguity. And that also goes back to that goodbye. And, when we do our trainings, Donna, one of the common things that we say to folks is, when someone dies, that doesn't necessarily mean for you that the relationship has died. And so that there's still that potential tension. And so the word closure can also be very offensive to some folks, where they don't believe that relationship has closed. I mean, the person is no longer physically there. Now, there's others where they might quite want to use the word closure because they want that relationship to be done and they don't want to continue or even believe in that. But just thoughts around closure.
Yeah, well, I was looking at a book recently that I very highly recommend, and it's not just about death and closure, but it includes the terminology closure. It's actually called, the book is called Closure: The Rush to End Grief and What It Costs Us. And the author is Nancy Burns. She's a sociologist in the Cultural and Society Department at Drake University. And in an article that she wrote, published in Context's journal in 2011, she says this, and I like this terminology because a lot of the words that we use in the field of death, dying, and bereavement are cultural constructs. So she says in this article, closure is a constructed concept, a cultural frame, how we translate our cultural and social experiences into explanations. And this is the key for how we should respond to loss. So it sets up a kind of false belief that when such and such happens, you may or you maybe should feel closure. And again, if a bereaved person wants to say, I felt like when X, Y, or Z happened, I had closure. It might be closure around a piece of something. It may be closure of other things. They get to say that about their own experience. I'm never going to say to somebody, well, that's not really closure.
Right.
On the other hand, when there's a societal pressure to achieve closure, or as if that's the thing you're supposed to do
Mm-hmm.
when someone dies, it's really problematic. And I remember in listening to families who had family members die after 9/11, after the Oklahoma City bombing, uh, where people said, well, when there's a trial or when someone who has perpetuated this has been convicted or even executed, for example, and people are like, oh, good, then, you'll have closure. Many of those families just say that there's no such thing as closure for me.
Mm-hmm.
It's a concept that actually some people find offensive
Mm-hmm.
because it implies you're supposed to close the book and again, other terms, you need to move on, you need to get over this,
Mm-hmm.
where we live in that kind of society that wants things to be tied up in neat packages. And to me, that's what closure represents. Like there's some magical ending, and that's not how grieving someone in your life typically works.
Right. And you just thinking about lived experience and working with folks, and folks have felt shame or guilt for not achieving this closure piece,
Mm-hmm.
and saying, I'm a little embarrassed about that. And when we're training or educating, in this context, I was, doing an education piece, and the it was almost like this relief or this freedom of, well, what makes you feel like you need to have that, or what does that mean for you?
Mm-hmm.
And just, the receptivity of opening up that space to say to grieving individuals, you know I hear that society uses, it's just this term that's always used about getting closure or needing closure, but really creating a space for folks to think about what that means. And is, again, going back to going and thinking about Boss's work, where it's like, do we need there, do we really need that? Does everybody need that? Is it for everyone, or is it person by person? And can we learn to live with the ambiguity around things? And it's this both and thinking. I think human beings tend to really want to think in dichotomy. And how do we learn to live with that both and thinking, right? That it
Mm-hmm.
is both this and it is that. It doesn't have to
Yeah.
be one or the other. And I
Well,
still think,
we want to tie things up in neat
right.
packages. We want to understand what we're supposed to do. I mean, I can't tell you how many grieving parents or even teens over the years I've heard say, I don't know if I'm doing this right. Did I miss a stage?
Right. Right.
I haven't felt anger, so people tell me until I do, I'm not really grieving.
Right. And
I want to read. Can I just share a statement
yeah,
from
yeah.
a bereaved brother?
Mm-hmm.
So this gentleman's brother died, and this is again from Nancy Burns' article in Context's journal. The article is called "Chasing Closure," and I really like the way he describes this. He says about his brother, closure implies finality, something ending or incompletion. I challenge those of you who have lost a loved one to tell me if a single day passes when that person hasn't been in your thoughts, even if only for the briefest moment. Closure never occurs because as long as all of us here today live, we will carry a part of this person in our hearts and our souls.
Yeah, it's beautiful. And it makes sense. It makes sense even with conflicted relationships. That there's been a death or a separation, and I'm thinking about young people in foster care that I work with, and their person hasn't died, but there's no longer any contact, and there was conflict, but that there's still this piece of remembering, right? Like it's almost like an imprint on us, and we carry
Part of who
that
we
with
are.
us.
It's part of who we are. It's part
Right.
of our fabric of our lives. I
Right.
think too, for me, a more helpful analogy for me personally is starting a different chapter
Mhm.
So like I might be starting the chapter of my life that begins now that my father has died. So I don't close the book on his life or the book on my life. I'm entering new territory. I'm entering the world without his physical presence.
Mhm.
But again, that doesn't mean I don't still have contact with him personally, in terms of whatever dreams, speaking to him, all kinds of continuing bonds.
Mhm. And that it just also reminds me, I think about, and I'm mindful of time, we have about 10 minutes left within that time, but of tenses that we use. So, in society, when someone's dead, you would use past tense. And I
Mm-hmm.
often use present tense for
Mm-hmm.
people that have died in my life, because for me personally, that relationship is still there. And so if I say, you know, whomever it is, yeah, he's such a wonderful person, someone knows that I'm talking about someone who's dead, they'll look at me, you mean he was? And I said, no, he is.
Yeah.
For me, that's present for, and again, I think we have so much work to do as a society to really honor each person's trajectory and each person's belief system. So I would never, like you said, Don, I would never correct somebody and say, oh, you should say that in the present, because that might not be their journey and that might not be their belief system. Likewise, I think we need to be considerate and attentive to understanding what each person's perspective is around death, and the whether it is an ending for them or whether it is a continuation, and just supporting them in whatever feels right for them.
Well, and that goes, I want to refer back to some of Nancy Hogan's work. One of the
I love
points
Nancy.
yeah. Hi, Nancy.
Hi.
One of the fabulous researcher and human being. One of the points she makes in this article that I referred to back from 1992 was that when these teenagers were responding to what they would say to their deceased brother or sister, the vast majority of them put that in the present tense.
Ah,
They didn't
interesting.
say, I
Mm-hmm.
would have said this, or I would have. They'd say, I
Mm-hmm.
would say, hey, buddy,
Mm-hmm.
how's it going where you are? I
Right.
love you. I miss you. And she was talking back then, and as others were, about this idea of closure or finality, or how we have to move on, put this death behind us, has been such a unhelpful concept for people who think that there's some magical moment that they are supposed to do something, or even a time frame. And I think that goes back to the whole medicalization of grief, and how that there's, if you take too long, it's pathological. I mean, that's another conversation which we will have.
We
But
will add that to our Dougy dialogue list, because I
yeah,
have plenty to say.
yeah. Well, the whole
So do
idea
you, I
that
know.
the whole idea and the terminology of prolonged grief
Mm-hmm.
disorder,
Mm-hmm.
just in the terminology, implies prolonged. You're taking too long.
Mm-hmm.
And so we have all these prescriptions for how people should be doing it that they don't necessarily feel they're living up to. And that adds more difficulty sometimes to what they're already tossing and turning about coping with this massive changes in their life.
Absolutely. Absolutely. And I appreciate you putting that little plug, because I've written that down as one of our, future dialogues. I
I
think
don't know
that's
if I
great.
can keep that one to 30 minutes, Monique, but I'll
Well,
try.
well, we might have a part one and a part two.
Okay,
Um, but I
fair
think,
enough.
yeah. And, it's just really about, and I think, as we do these, just, topics that come up, and I'll just kind of jot them down. But yeah, I think that's really a good starting piece for us, Donna, to capture, our intention behind the language we use in our resources, and providing a little bit of background information to why we choose or don't choose to use certain terminology.
Mm-hmm.
And I know we, in this particular conversation, we're obviously not going to be able to cover everything that we'd want to say around a topic, but it's good to just begin having these conversations, I think, around just some of the language that we're using in our field, some of the things that are kind of imposed on us by society, and challenging that a little bit when it doesn't right to us.
And not just imposed by society, but sometimes by people within our field, within,
right.
you know, the field of thanatology, the study of death. So I look forward to looking at all kinds of terms. And, you know, today we've had the opportunity to look at why we didn't choose on our tip sheets, this particular tip sheet, to say saying goodbye.
Mm-hmm.
Again, all of these are personal, vary, but I think it's helpful to kind of open them up and just unpack, well, what do we mean by that? And
right.
Are we prescribing things for people that maybe don't fit or aren't helpful to them?
Absolutely. Well, we are at time, so I just want to
Okay.
say thanks again for chatting, or I should say dialoguing with me. And
yeah, thank you. It's been fun.
Take good care.
You too.
Bye-bye.